a podcast dedicated to empowering you with the knowledge and habits that keep your heart strong and healthy. In today's fast paced world, where stress is high, lifestyles are sedentary, and processed foods often replace wholesome meals, heart disease has become one of the world's leading health concerns. And alarmingly, it's affecting younger people more than ever before. Hi, I'm Huma Qureshi, and in this episode, we are joined by a leading physician to help us understand how we can protect our hearts, detect early warning signs, and make choices that ensure a longer, healthier life. Together, we break down the science into simple, actionable steps that you can start today, because a healthier heart means a healthier you. So, doctor, tell me, why are so many people today, younger people, even celebrities, getting heart attacks at just 40? I mean, aren't heart problems for older people?
So, what we are seeing mostly these days is that a lot of young adults, under the age of 40 years of age, they are suffering from severe cardiac ailments, mostly like cardiomyopathy, myocardial infarction, and even certain problems like sudden cardiac death due to dilated cardiomyopathy. So, mostly what we see in these subset of the patients are that they are leading a sedentary form of lifestyle. These lifestyles are mostly they are having a very corporate thing with a lot of time mostly on the chair with the banking officials or higher level of corporate people, and they are mostly addicted to lots of unhealthy habits that we can say. It's like the obesity, the smoking, and chronic alcohol drinkers, which are even intervals of 1 or 2 days. So these finally leads to the increase of the triglyceride levels, the increase of the abdominal girth, and finally these all additive factors lead to the this clotting of the blood vessels of the heart, and the myocardial dysfunction takes place at this age. And even we at the South Asian population, we are much more prone to the genetic dysfunction, and as a result of that, so the cardiac susceptibility and the cardiac dysfunctions are quite high compared to those of the Mediterranean or the Caucasians in our population.
So, what are the warning signs that I should never ignore when it comes to my heart? And when should I see a doctor?
So, what are the typical symptoms that we can see in these patients? Right? These patients always complain of sudden diaphoresis, so like sudden form of sweating, sudden uneasiness or heaviness on the chest, or even night sweats, and even increase of heart rate, and they complain of the palpitations. So these can be added with other symptoms like they can be having syncope, reeling of head, and these can be much more detrimental if these patients are on two-wheelers or doing some activity on alone, like driving a bike, a car, or even swimming activities where there is a lot of physical activity required. And these incidents, these happenings, they do require a lot of blood pressure increase, and finally that correlates with the increase of the cardiac dysfunction and the cardiac stress load, and finally they land up in such kind of problems.
And what are the most important daily habits that people can adopt to keep their heart healthy and to reduce the risk of heart disease?
What lifestyle changes are the first step that we can suggest for any young adults at this age. First is the checking of the obesity. The obesity needs to be decreased drastically. The abdominal waist circumference is the first agent of rapid increase of the dysfunction of the cardiovascular system, or even the neurological also. Then we do suggest for having a good quality exercise of weekly of 150 to per week, 150 minutes per week, or even if that not possible, 30 minutes or 40 minutes of a brisk walk can be suggested. A good healthy Mediterranean lifestyle diet with fruits, nuts, and vegetables and salads should be definitely it should be on the plate. And next, the third thing should be curtailing of all the habits, such like smoking and alcohol and each and everything. So these medications are the second priority, and whenever we suggest we go for the lifestyle changes, that's the suggestion first, and then go for the medications or all which are the second step in our modality of treatment.
How much do diet and physical activity actually affect your heart health, and what are your top recommendations?
So, apart from the lifestyle changes, there are coming up a lot of other functional medicine issues that we do suggest in these young adults. Not only of the changing of the dietary habits, changing to a dash or a Mediterranean form of lifestyle, and the secondly is the having a good heart screening of at least once in 6 months or once in a year in the cardiac risk patients. Risk patients I need to specify is like mostly of those of the young adults whose parents are diabetic, whose parents are having a cardiac risk problem. They are much more susceptible to the genetic dysfunction in their growth and in their lifestyle also added to that. So we need not only that, we need also the regular blood tests like the apolipoprotein and even the fasting insulin levels, so that we can have a better sensitization or better risk factor assessment with high sensitivity CRP levels, so that we can classify them on a high risk patient or a low risk patient, and even the HOMA IR, which gives a very good sensitivity of the insulin levels and how much you are much more prone to diabetes and cardiac risk problems in the near future.
What about stress? Does stress actually affect the heart, and what are the practical steps that one can take to reduce it?
Yeah, there, apart from all this cardiac, we just don't suggest that go in for one particular heart related issue. There are many small things which builds up all throughout the life of these patients, which are missed each and every point, and finally it leads to a catastrophe of the heart attack or some kind of dysfunction. So what we suggest is the screening definitely, and going for ECG to check for any arrhythmias, have a good blood pressure regulation, a good and tight blood pressure regulation can have a very good effect on your heart. Even if some doctors give you medications and you stop them after a few days, that's severely detrimental. Then coming to the mindfulness, the whatever job you are doing, you should specifically restricted job to that place. Don't take the job at your back to your home. Have a quality sleep time of 7 to 8 hours daily. The less amount of sleep time has it's documented and it's coming in the publication also, that if you sleep less than 6 hours, then automatically the chances of stroke, heart attack, the cardiac problem risk, they all increases a lot. Social awareness of all these things with the friends and near ones, each and everybody, which will help all and everybody to have a healthy lifestyle and prevent not only you yourself and your family also in the long run.
Well, as we wrap up today's conversation, remember, your heart's health is in your hands. Every small change you make, from the food you eat, the way you move, and how you manage stress, adds up to a stronger, longer life. We hope the insights have inspired you to take those steps starting today. After all, your heart works for you 24/7. It deserves the same care and commitment from you. Thank you for tuning in. Until next time, keep your heart happy and it will keep you going strong.